Hi everyone, Dr. Timothy Gallagher.
And Dr. Michael Marciello.
And we're from Maragal Medical. So you have tingling in your hand, you've been diagnosed with carpal tunnel syndrome, and you've gone to a surgical consultation. This week we're going to talk to you about alternative options for treating your carpal tunnel syndrome. You're not going to want to miss this one. We've got some great information here, so stay tuned. Okay, Mike, we got tingling in the hand. We've got a diagnosis from a physician that you have carpal tunnel syndrome. What comes up with the diagnosis of carpal? There's certain steps where you actually have to accurately diagnose this, right?
I think that's the key, is that carpal tunnel is probably overdiagnosed for what we all feel. Because again, someone says they have hand tingling, they immediately go carpal tunnel. Oh, I type on the computer. But there are many things that have to be looked at. The distribution of the tingling is different for one nerve versus another. There are different nerves that can get trapped in the arm. There's a nerve that can come down from the neck, like a lot of people get a so-called a pinched nerve to their neck. That could always refer down into the arm, but eventually extend out to the hand. So there's a lot of overlap tingling symptoms that we want to identify, because the carpal tunnel is an entrapment of the nerve. It's called the median nerve in the wrist. That's the carpal tunnel. And that's the only thing that can cause carpal tunnel. All the other potential reasons of tingling has to be identified.
Right, and it's a tunnel. It's simply a space, right? And with overuse with computer work, sometimes you get inflammation or hypertrophy in that area, and that's what compresses it, correct?
Correct. I always say that if you just looked at the wrist, cut the wrist through, and you look down in the wrist, the bones are on the bottom, that's the floor of the tunnel. There's a ligament on top, that's the roof of the tunnel. If there ever was surgery to help repair it, they just take the roof off and remove that ligament, kind of sew back the skin, and now there's a lot more room in there. But what we could potentially recognize that there's other ways to decrease that tunnel size. And so again, when the compression is there and we don't need to remove the roof, how can we decrease the swelling in the nerve? And that's what we're looking at, ways to try to treat, because you don't always have to have surgery, and you don't necessarily always have to have a nerve test to identify there's other causes that this might be coming from.
Right, because there's no guarantees with surgery, right? We always say we're not against surgery, but surgical options should always be your last option. And then when we look at, alternatives, what are some of the alternatives that we can do? I know class 4 laser therapy works really well. Of course, bracing.
I think bracing is the most common, but I think what happens mostly is that people are told to wear a brace, but bracing for carpal tunnel is not an overnight thing. You have to stay with it consistently every night for several days, several weeks at times, perhaps using it during the day, because we have to make it so you don't keep on re-aggravating that nerve in that tunnel. So bracing is a very good option, but it has to be used more consistently. That's not emphasized. But then again, how do we get the inflammation down? We could use, again, anti-inflammatory medicines for a short time, or prednisone if it was so acute, for a very brief time. And then we're trying to reduce inflammation, right? So we can get the laser treatment. And we could do chiropractic manipulation in the hand, can't we?
Sure.
That's all trying to get some movement to that nerve and that space to calm down the nerve, diminish those tingles, and get the person conservatively treated.
And we always talk about dangers of cortisone, so cortisone injections, that's going to be a common option too. So, certainly if you've stayed tuned, that cortisone is something that you don't want to have done. What's the alternative for cortisone? We can use those regenerative medicine injections.
Right. Yeah, certainly, again, a regenerative injection it's injected the same way. It's placed into the carpal tunnel groove. It kind of treats the nerve and tries to get that inflammatory process down, so that it's not going to be harmful to the nerve itself. We know for certain types of cortisone, the cortisone material can deposit in the nerve. So even surgeons recognize that if they wanted to do an injection of cortisone, they only have maybe one chance to do it, because it can cause problems later if they ever to do surgery. So we're trying to say, let's not do it at all as the best choice.
Yeah, you definitely want to think about those alternative options. And first and foremost, the examination, the accuracy of the diagnosis is going to be paramount. And that's what Dr. Marciello does. He's a medical doctor that specializes in musculoskeletal conditions. Here at Maragal Medical, we rely on this team approach where medicine, chiropractic treatment, physical therapy all work together under one roof. We have a special expertise and interest in the field of regenerative medicine, and folks, we take most insurances. More information can always be found about our practice on our website, maragalmedical.com. We've got a wealth of information on our YouTube channel. Please consider subscribing. That's it for today. I hope you learned something. Have a great day, everyone.
Take care.